next up, speaking of chief medical officers, someone who has her hands full these days in running one of the hottest digital health groups and companies, technology platforms that is truly diffusing across the ecosystem in ways that we couldn't have imagined 5 years ago, and really reinventing what it means to be patient-centric, is Dr. Melynda Barnes. Melynda, thank you for joining us today.
Thank you for having me.
And really appreciate you taking out your time. We know how busy you are, and we know how busy even 10 minutes means out of your schedule. So first of all, you're a brilliant physician. You could be doing anything in the world. What led you to Roe and to take the role on that you do have now with them?
Well, yes, thank you so much to having me here and for that really nice intro. Honestly, frustration. I was a practicing facial plastic surgeon and ENT surgeon, and I had all of these ideas, and everyone just kept saying, like, Melynda, you're such this innovator. You should like start a company. Or, I was frustrated, and people just kept saying, but you're a doctor. Just be a doctor. Why are you concerned about, these inefficiencies or ways to optimize sutures in the operating room? And so I started looking out, and I came across Roe, and I just fell in love with their mission to democratize healthcare, to imagine a healthcare ecosystem outside of insurance that would allow us to put patients, providers, and pharmacists at the center. It's amazing what you can do when you're not focused on reimbursement and making sure that you're hitting the 5 out of 6 points in your note to be able to reimburse at a level 5 or a level 4. So they had a ambitious mission, and that I love challenges and I love problem solving. So I was all in.
That's fantastic. And it's a lot like some of the folks we spoke with earlier in the program who had the same kind of, find me my next passion. That's really why I want to be on this thing. And by the way, congratulations on your recent award of being named the top 40 of under 40 in the U.S. healthcare system. That's a tremendous honor, and certainly is wonderful and well-deserved, by the way, too. I think, everyone's trying to understand virtual care, pandemic 2.0, these sorts of things have all driven the rapid acceleration of the diffusion of Roe into the ecosystem. Where do you see it going next over the next 3 years in its growth as we transform into kind of a post-pandemic society, knock on wood on that level?
Yeah, I think for sure telemedicine and remote care is here to stay. Not only did patients in some situations prefer it, but so did providers. I think the future looks like just like our work from home future, a hybrid situation. There will be patients who start their journey digitally and via telemedicine with their providers. At Roe, we're doing the same thing. We acquired a company, WorkPath, which allows us to send phlebotomists into the home. We just did a COVID vaccine drive at New York State, where we were able to send vaccinators into homebound patients' homes to get them the COVID vaccine. And so we realize we're digitally native, and a lot of our patients start their journey online with us, but there are things for which we need to cross that digital divide. And so I think the future looks like this omni-channel hybrid system. And ideally, we continue to have really robust partnerships between direct-to-consumer, patient-centric brands and our traditional academic centers. We need both. Both of us have to work together to really improve and revolutionize how healthcare is delivered and trying to decrease the cost that we all pay for healthcare in our country.
Yeah, and that's a huge issue, as obviously everyone knows, just the healthcare costs in the United States being the highest in the world, outcomes nowhere near the highest in the world. There's a massive gap, and a big chunk of that gap is accessibility. And Roe is addressing that. I mean, like you just talked about, accessibility is measured in a lot of different ways. And talk a little bit about that. Roe is such a patient-centric platform. Talk a little bit about how you're going to continue to meet those needs, especially coming from your side of the house on the clinical side and really, conducting and working on the outcome side. What kind of technologies, what kind of innovations do you see happening along those lines?
Yeah, absolutely. Devices, connected devices And not just, some people think of remote patient monitoring and they're thinking of in-home ICU care. I'm thinking of connected glucose monitor devices. I'm looking at connected blood pressure cuffs, connected scales, like being able to get real-time data from our patient. The concept that we go to the doctor once a year, the doctor gets a snapshot of our vitals at that time, and that sets the course for the rest of that year until we get that other annual, I think is something that we should be innovating out of. And so, how we bring devices onto our platform is one of our challenges for the near future. Secondly, would be diagnostics along those same lines. So, how do we again connect that digital divide? Someone may start their workup online, but how can we bring diagnostics to our patients without necessarily having to send them to the lab? I think for outcomes, really thinking about what matters to patients, what keeps them motivated, what keeps them engaged in their healthcare. We know from our own internal surveys that 68% of our patients had never sought care for their condition prior to coming to Roe. So that means that we were the first touch point to the healthcare system with this patient. They took extra motivation to come and seek us out. How do we capitalize on that and start talking to them about things like colonoscopy, prostate screening, mammography, getting your flu vaccine? And so taking that motivation that they have to treat the conditions that we have on the platform, and then really translating that into conditions that also will affect their morbidity and mortality.
Fantastic. Well, again, thank you again for joining us today. And we know it's top of the hour, and we want to respect your schedule. And looking forward to working with you again. And congratulations on all your success and Roe's success as well.
Thank you so much, and happy to be here.
And really glad to see, by the way, that Roe is a startup from a Columbia alum. So kudos to that, and I'm really excited to see that. So on behalf of everybody at the HIT Lab, but specifically the production team of Justin Bulova and Madison Lazar, we want to thank all of the faculty, speakers, the guests, and especially you, the attendees, for joining us today and really exploring the depth and the nuance of this digital health revolution, going from single digit adoption to now double digits, high double digits adoption of a lot of digital health tools, including Roe.com. And thank you for joining us. We know your time is precious, and we appreciate you spending some of it here with us. And of all things, most importantly, please stay safe. See you on May 27th for the next symposium. Stay well.